So this past weekend, they held the boys' state basketball tournament. Thousands of kids, whether on the court or in the stands, piled into the Ford Idaho Center in Nampa to play, to watch, to cheer on their high school team. What if I told you for every 10 of those kids, 4 of them have struggled with moderate to severe depression? 44% of high school students, according to a survey done by the Boise School District a couple of years ago. And 33% have thought about suicide. That's just one of the reasons the Boise Youth Behavioral Health Initiative was launched last fall, to address this and to provide parents with resources for mental health. Teachers and administrators have made it clear, schools, they do not have the resources they need to deal with these needs. But this is obviously bigger than Boise, which is why lawmakers at the State House are stepping up to fill in those gaps, hopefully. Joe, what are the lawmakers focused on with this topic, and what happened today? Because this is something that is kind of moving forward a little bit.
Yeah, and really what this is about is getting resources into Idaho classrooms. And we talked about Boise, but we're really meaning the entire state here. So getting the right resources to students, that's what this legislation is all about. And we know that there is mental health conversations, but getting resources like counselors and trained therapists into schools, it's not a snap of the finger trick. But what if needed experts could connect with students at school digitally? So House Bill number 684 looks to create a code for optional behavioral health telehealth services in public schools, as well as charter schools. Legislation essentially would allow public schools in Idaho, not forced by the way, to provide access to behavioral health via telehealth on their premises during a school day, so a student wouldn't have to miss any school time. The mental health professionals providing the services, they would be selected by the student and their parents. The school would have nothing to do with that. So if a school district wants to do this, students would be supplied a closed room for sessions and technology to connect on, Zoom or WebEx or whatever, to chat with a doctor or a counselor that they need to connect with.
Kids are already getting bullied for so many things. And when they get bullied, they need services like this.
This would provide another opportunity for access and ease the burden on the family to be able to help the child.
This is an opportunity to expand capacity to support our students across the board, and it's done so under the direction of parents. That's the critical component here. A student will never find themselves in a telehealth session on a school campus unless a parent has requested it.
There are kids in our school systems that need that help, and if we can get them that help, that is what we should do. So I will be giving this a green light. Thank you.
Thank you. Okay, so those are the supporters. So the critics of the idea, they worry that schools are going further and further away from the role of being education institutes. There's also questions about the content of the sessions that would be allowed to happen on school grounds. For example, it was brought up, what if there's a transgender student that is getting a session on their transgender care? One lawmaker also asked if this would make things worse for students.
I'm just concerned that our schools are not doing their primary responsibility, which is reading, writing, and arithmetic. We're getting into all different venues that our schools they're basically becoming the nanny state to take care of every little issue. And I just think this is a slippery slope with continuing to push other things in our schools that's not dealing with the primary responsibility of what our schools should be doing, and for that I'm against this bill.
We're putting them in a room that all the kids know that they are going there for counseling, which is going to lead to more issues, possibly bullying. And so are we perpetuating the issue by doing this?
So again, the legislation did pass in the Idaho House this afternoon and now heads to the Senate. Again, Brian, a real piece of information here. This would be an optional thing that schools could do. There would be no school districts that would be forced to allow students to do telehealth during the day.
How many voted against this bill?
Only a handful. I think about 13, maybe a dozen, yeah.
Safe to say that those that voted against it are the same ones that would say it's not the guns when it comes to school shootings, it's the mental health. That's the problem?
Yeah, we'd have to look up at those two votes, which would be interesting to see who voted for what. But yes, very specific segment of politicians that voted no on this today, and we heard some of their concerns.
Interesting. All right, thanks, Joe.